Hello people, in this video we want to look at this book Community Medicine with Recent Advances by Suryakantha. So this is for Preventive and Social Medicine, PSM, right? So this book is alternative to Park, looks like the same amount of thickness though. So here they are telling highlights Anemia Mukt Bharat, health insurance schemes, like what health insurance schemes do you know? Epidemiology of suicide. Why people suicide? Because they don't know how painful death is. That's what I feel. Poshan Abhiyan, something to do with nutritious food, looks like. Corona, so this is new, looks like. Human organ transplant, POCSO, 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 right? And many more. Okay. So, looks like there are some few colorful images here. And then starts the textbook, which is completely black, blue, has some images, a lot of information. Some tables, flowcharts, graphs, numbers. So you get the point, right? So we want to look at this book a little in detail. Let's look at the contents. So you have the basic concepts of community medicine. So you should understand here the preventive medicine. Basically, they will tell you the natural history of disease and at what levels you can prevent. So this is preventive and social medicine, correct? So the concept of prevention they are telling you. There is primary prevention, under which you have, actually it's a primordial prevention, right? Before primary itself, that should have come there. So then you have primary prevention. So when there are risk factors, you want to avoid disease, right? That is primary prevention. Health promotion, specific protection. Okay, then you have the secondary prevention, tertiary prevention. So this and all basic terms that you should know, okay, in community medicine. Then you have environment and health, noise levels. They're telling you water, how to maintain. They'll tell you how to purify water, all that, adding bleaching powder. Do you know how to calculate the amount of bleaching powder required, right, for cleaning your swimming pool or to make it drinkable water, right? Air pollution, they are talking about housing standards, like how big should a room be, where and all the windows should be, all those basic things they are teaching you, which some people find really boring, including me. Then you have what else? Disposal of waste. So you have all those colored bins. Yellow takes all your anatomical waste and all the blood stained waste. So that is where it is. Yellow takes all the red, you can remember like that. And the red bin actually takes plastic. Okay. So management of hospital waste. Then coming to entomology, they're teaching you all about mosquitoes. So basically mosquitoes, guys, remember, okay, mosquitoes are like bread and butter for community medicine people, though I don't see any improvement done in mosquito levels. They're only increasing more, right? And then coming to occupational health, yes, so as occupational physical hazards, you should be able to make an ergonomic work environment, remember, right? Then what else? Main important diseases, right, of the lungs. You should know them. Then epidemiology. There is something here called as studies, right? You will have studies, like you have the cohort study, you have the, what is that? Control study, right? All that wait, I'll tell you. So that we will come to. Then you look at these cold chain, how you will manage vaccines, right? So there's reverse cold chain also, etc. Then main diseases, communicable diseases you should know are tuberculosis, Then you have here everything that is basically spreads from one person to the other, right? You should know these. So they are covering all diseases, and under every disease they have given you the history, the clinical features, all the small subheadings also they have given very detailed in the contents. Okay. So you should know polio, rabies and all, very, very important for passing community medicine. Okay. Similarly, they will cover what is this? Non-communicable diseases. Look at this here, guys. Focus. We are looking at the Suryakantha textbook. Okay, just in case you are lost. Look at this. Okay, so now non-communicable. You will talk about what? Diabetes, right? Coronary vascular. Okay, cardiovascular diseases. Focus, people. Obesity, cancer. You have something called as an NCD in government hospitals. NCD, non-communicable disease itself, separate department will be there, right? So what else is there in this contents? All those different very important health programs, national health programs you should know. Okay, program for control of blindness and visual impairment. So all those they have covered here. The one good thing is all the national programs they have given list here, right? So now let us look at some images also. Focus, people. What is this? Poshan Abhiyan. So this logo you should know. Sometimes when you go for this community medicine quiz, right, they can give this logo and ask what it is. Poshan Abhiyan. PM's overarching scheme for holistic nourishment. Have you heard this word, overarching? Okay. So I think they've updated all this virus photos, coronavirus. So this and all photos you should know. This is larva of what? Mosquito, right? I am thinking it is mosquito. Anopheles and Culex. So there are many types of mosquito, right? You should know them. What are the differences between these mosquitoes? What is the difference between an Anopheles mosquito, Culex mosquito, Aedes mosquito? Mansonia I don't remember reading, but these three we did read, okay? So this you should know. These differences you should know. Those are the mites, right? This one is a scabies causing thing. What is this? House dust mite. Okay. Sorry, this is the scabies causing one. Sarcoptes scabies. Sarcoptes scabies. Scabies. Something about the rats there. Let's look at how it deals every chapter. At the end, what is there? Let's see. See, at the end of every chapter, I don't see any summary or anything like that. I don't see any MCQs or short questions that they have asked. Don't see that kind of information. However, that shouldn't judge the book. Let's see. What is there in this table? Assessment of the child with diarrhea for degree of dehydration and management. So look for whether the child is alert or not, whether its eyes are sunken, whether there are tears when it cries, whether the tongue is dry or moist. Okay, all that. Skin pinch you should check. All this, okay. So I think you have an idea of this. This is the population pyramid, right? Yes. High time to control population, at least for our country. Let's do one thing. We'll look off at some national level programs also. What is this logo? WHO. Oh, WHO has a snake. World Health Organization. Okay. You have the National Mental Health Program. What do you see here? Mental health. How are they addressing this? In NCD they are addressing, is it? And then look at this one. This one is very important. IDD, National Iodine Deficiency Disorder Control Program. Wherever you see this IDD, you should know this. National Iodine Deficiency Disorder Control Program. Okay. So that is why they have this iodized salt and all, so that people don't go into iodine deficiency. If they go into iodine deficiency, what will happen? Yes, they will develop thyroid problems, because of which there can be many other rollover problems because of thyroid, right? So, what is this? Telemedicine in health, public health, modern telemedicine system. What do I see here? I just see a monitor. Okay. The patient can talk and get guidance over the phone or something. Okay. So this is a complete detailed review of this book by Suryakantha for community medicine, PSM.